Imagine spending like tens of thousands of dollars on state-of-the-art medical technology. You know, you are utilizing microscopic cell manipulation, highly calibrated incubators, and advanced pharmacology to orchestrate human reproduction in a lab.
Right. It's the absolute pinnacle of clinical exact science.
Exactly. And yet, one of the most statistically significant ways to improve the success rate of that futuristic endeavor involves a protocol that has been around for literally thousands of years.
Oh, yeah.
I mean, we are talking about the strategic placement of incredibly thin needles to alter the entire metabolic environment of the human body.
That juxtaposition is just striking. We tend to view modern reproductive endocrinology and, ancient somatic therapies as existing in two totally separate universes. But the data is really forcing a complete paradigm shift in how we approach fertility.
It really is. So for today's deep dive, we are unpacking a fascinating set of source material that bridges those two universes for you. We're looking at a comprehensive analysis by Mike Berkeley.
Right, the founder of the Berkeley Center for Reproductive Wellness.
Yeah, exactly, which has been operating out of New York since 1998. And he breaks down a brand new, major systematic review and meta-analysis published in the journal Frontiers in Endocrinology. This came out in May of 2026.
And this publication is a highly specific, very mathematically rigorous look at a particular demographic in the fertility world. It basically strips away the ambient noise and focuses purely on high-stakes clinical outcomes.
So we're going to explore one core question today. Can a time-tested complementary therapy, specifically acupuncture, actually move the needle on clinical IVF and ICSI outcomes? And crucially, can it do this for women dealing with polycystic ovary syndrome or PCOS?
Right.
Okay, let's unpack this, because to really appreciate the gravity of this May 2026 data, we need to acknowledge the specific obstacle course that PCOS presents during an IVF cycle.
Yeah, navigating a standard IVF protocol is already a complex physiological undertaking, but introducing the metabolic and hormonal dysfunction of PCOS turns it into an absolute high-wire act. You are dealing with systemic insulin resistance, elevated androgens, and, persistent chronic inflammation. That underlying dysfunction makes the ovaries incredibly unpredictable when they're exposed to exogenous fertility medications.
Right, they can go in the opposite direction.
Exactly. They might be fiercely resistant to stimulation, or they might swing the other way and overreact completely chaotically.
Well, I have to step in here and play the healthy skeptic on behalf of everyone listening. Because when we talk about a condition as deeply entrenched in systemic endocrinology as PCOS, and then we introduce the idea that lying on a table with tiny needles in the skin is going to somehow recalibrate that dysfunction, it sounds a bit overly optimistic, doesn't it?
Sure, I hear that a lot.
Are we talking about like an anecdotal placebo-driven phenomenon where the patient just feels a little more relaxed? Or is there actual hard empirical science driving these claims?
Well, it is the most vital question to ask. Primarily because complementary therapies were historically brushed off by the traditional medical establishment as mere feel-good add-ons for exactly that reason. What's fascinating here is the sheer scale and the uncompromising rigor of the data from this meta-analysis.
Yeah, in the hierarchy of medical evidence, this methodology sits at the absolute top.
Oh, without a doubt.
We are looking at researchers who aggregated data from 22 distinct randomized controlled trials encompassing 2,299 women with PCOS who were actively undergoing IVF or ICSI.
A sample size of nearly 2,300 patients across multiple controlled environments effectively eliminates anecdotal bias. It obliterates the placebo effect.
Right, you can't fake numbers like that.
Exactly. It provides a crystal clear, statistically powered picture of biological reality. When you introduce acupuncture to standard fertility treatments for this specific, highly complex demographic, the background noise fades, and the actual clinical impact becomes undeniable.
And that mathematical certainty is what makes the findings so compelling. We aren't just spotting coincidences, we are observing a replicable physiological shift. Here's where it gets really interesting, though. Let's look at the headline numbers.
Let's do it.
So for the women who incorporated acupuncture into their standard IVF or ICSI protocols, the data showed a 13% increase in the clinical pregnancy rate.
Taking that a step further, the data also revealed a 15% increase in the live birth rate.
Wait, 15%?
Yes, 15%. And in the highly pressurized world of reproductive endocrinology, clinics will routinely overhaul their entire laboratory protocols, investing in new culture media or upgrading their embryology tech just to chase a 1 or 2% increase in outcomes.
Wow, just for 1 or 2%.
Right, so seeing a 15% bump in the likelihood of a patient actually taking a baby home is monumental.
But the deeper story here isn't just about the ultimate destination of a live birth. It is about how acupuncture seemingly transforms the grueling journey of the IVF cycle itself. The researchers tracked clinical markers throughout the stimulation phase, and the acupuncture group experienced a fundamentally different physiological response to the medications.
Right, because the stimulation phase for a PCOS patient is notoriously difficult to manage. However, this meta-analysis demonstrated that the acupuncture group produced a higher yield of optimal, high-quality embryos available for transfer.
Which is the whole goal.
Exactly. Furthermore, they exhibited optimal estrogen levels on the day of the HCG trigger shot, which is a prime indicator of robust follicular health and readiness.
The detail that really stands out to me involves the medication burden. The women receiving acupuncture achieved these superior results while requiring a lower total dose of exogenous fertility medications, and they were on those medications for a shorter duration.
Which is huge for the patient's body.
Absolutely.
Yeah.
I was trying to visualize the mechanics of this, and it feels very much like driving a car with a sticking parking brake.
Oh, let's follow that thought.
Okay, so if you picture standard IVF for a PCOS patient, their baseline metabolic and inflammatory dysfunction is the sticking brake. To get the reproductive system to move forward and produce mature follicles, the clinicians have to push the gas pedal incredibly hard.
Right, they pump in high doses of heavy-duty gonadotropins for an extended period.
Exactly. But this data suggests acupuncture doesn't act as a second gas pedal. It acts by releasing the parking brake.
Oh, that makes perfect sense.
Right. It conditions the systemic environment so the engine can do vastly more work with less fuel. You don't need to press the gas as hard, hence the lower medication doses, and you get up to speed much faster, hence the shorter duration.
That translates perfectly to the physiological reality. The systemic resistance of PCOS actively fights the medications. By releasing that biological brake, you not only improve efficiency, but you also avoid pushing the system into a dangerous tailspin.
Yes, which brings us to the most critical safety revelation in this entire review.
Right.
The impact on OHSS risk.
Ovarian hyperstimulation syndrome. Yes, this is the ultimate nightmare scenario for any fertility specialist treating a PCOS patient.
It's terrifying.
It is. Because the ovaries are so unpredictable, they can hyper-respond to the stimulation medications, producing a massive number of follicles while basically leaking fluid into the abdominal cavity. It is a severe, potentially life-threatening complication involving blood clots and kidney strain.
Normally, in standard clinical practice, if you push a PCOS patient to produce more eggs, better embryos, and higher estrogen levels, the risk of triggering OHSS goes through the roof. You just assume the ovaries are being pushed into overdrive.
Yet the meta-analysis explicitly showed that despite improving all of these high-yield metrics, acupuncture did not elevate the risk of OHSS.
That is amazing.
It really is. It managed to improve the functional efficiency of the ovaries without pushing them into a state of chaotic hyperarousal. It facilitated homeostasis alongside stimulation.
That balance is incredible.
Mm-hmm.
So we have a firm grasp on the what. We know the empirical reality, 13% higher clinical pregnancy, 50% more live births, superior embryos, lower medication burden, and no increased risk of hyperstimulation.
Right. The numbers are clear.
But as someone who needs to understand the mechanics, I have to know the why. How does the insertion of microscopic needles into the skin literally alter cellular and hormonal outcomes to this degree? We need to move from the statistical outcomes into the actual biology.
The transition into the biological mechanisms is where this becomes truly fascinating. Mike Berkeley's analysis breaks down the pathways beautifully. At its core, acupuncture is a neuromodulatory intervention. It utilizes the peripheral nervous system to send signals that trigger cascading chemical effects throughout the central nervous system and the endocrine system.
Let's trace that pathway for the listener. If we start with the physical insertion of the needle, we are essentially creating a microtrauma, right? This stimulates mechanoreceptors in the skin and muscle, which fire signals up the dorsal horn of the spinal cord and into the brain. One of the first systemic responses the source notes is a dramatic improvement in hemodynamics, specifically blood flow directed to the ovaries and the uterus. Right. The neural signaling prompts the release of powerful vasodilators, primarily nitric oxide, into the bloodstream. This dilates the blood vessels, forcing rich oxygenated blood into the pelvic cavity. And for a developing follicle or a uterine lining preparing for embryo implantation, that localized perfusion is critical, isn't it?
Absolutely. You are delivering the maximum amount of nutrients while simultaneously flushing out cellular waste.
Which flows perfectly into the next major mechanism the source highlights, which is the reduction of systemic inflammation and oxidative stress.
Yes, we know that the microenvironment of a PCOS ovary is often highly toxic due to elevated reactive oxygen species.
It is a state of chronic oxidative stress that essentially damages the cellular integrity of the developing eggs.
Exactly. The increased blood perfusion acts as a biological flush, clearing out those reactive oxygen species. Simultaneously, the neuromodulation triggers anti-inflammatory pathways.
So when you reduce that systemic inflammation, you are fundamentally altering the local environment of the ovaries and the uterus. You're creating a hospitable ecosystem.
Right.
It is treating the soil so that the seed actually has a chance to thrive. You can have a genetically normal embryo, but if the uterine environment is highly inflamed and hostile, implantation is going to fail.
Spot on. And that localized inflammation also drives a systemic stress response, which leads us to the hormonal mechanisms. The source emphasizes acupuncture's ability to lower stress.
And in reproductive endocrinology, stress isn't a psychological abstraction. It is a measurable biochemical barrier, primarily driven by cortisol.
Right, and cortisol directly interferes with the HPO axis, the hypothalamic pituitary ovarian axis.
If we look at the neuroendocrine signaling, the hypothalamus relies on highly specific pulsatile releases of GnRH to tell the pituitary gland to release FSH and LH, which then tell the ovaries to mature an egg.
Yes.
But when a patient is swimming in chronic cortisol, it acts like static on that neuroendocrine communication line. It blunts the GnRH pulsatility. The signals just get completely scrambled.
So by down-regulating the sympathetic nervous system, the fight-or-flight response, and up-regulating the parasympathetic rest and digest system, acupuncture lowers that cortisol burden. It literally clears the static off the HPO axis.
That is fascinating.
The brain and the ovaries are suddenly able to communicate clearly again, allowing the exogenous IVF hormones to work synergistically with the body rather than fighting against a scrambled internal feedback loop.
The final biological mechanism mentioned in the source material is the one I found most profound because it operates on a microscopic, almost quantum level within the cell. We were talking about supporting mitochondrial health and oocyte quality.
Oh, yeah.
Instead of the old cliche of mitochondria just being the batteries of the cell, I prefer to think of them as a microscopic power grid.
That is a much more accurate framework for understanding oocyte maturation. The process of an egg cell dividing, maturing, and preparing to become a viable embryo requires a massive, sustained surge of ATP energy.
It is one of the most energy-intensive cellular processes in the human body.
It is, and if a woman with PCOS has underlying metabolic dysfunction, her cellular power grid is highly unstable. The energy supply might fluctuate or fail to meet the immense demands of meiosis, resulting in poor egg quality and fragmented embryos.
But the data implies that by lowering systemic inflammation, improving blood flow, and balancing the endocrine signals, acupuncture actually stabilizes that cellular power grid.
Yes. It creates the exact metabolic conditions necessary for the mitochondria to function at peak efficiency. This therapy is so effective for PCOS precisely because it isn't a blunt instrument forcing a single outcome. It is a comprehensive intervention that treats the underlying systemic dysfunction, the hemodynamics, the oxidative stress, the HPO axis communication, and the mitochondrial energy grid. It optimizes the host environment so that the highly targeted science of IVF can execute its purpose without constantly battling the patient's own biology.
Bringing this out of the laboratory and into the real world, what does this look like for the listener? If you are currently navigating the complexities of an upcoming IVF cycle, how do you operationalize this data?
Yeah, that's the key.
Historically, patients have often felt pressured into a false dichotomy, believing they had to choose between the natural holistic route or the sterile clinical Western route.
And the model utilized by the Berkeley Center, and increasingly by progressive clinics worldwide, proves that the modern standard of care is true integrative medicine. The clinical application involves combining these modalities in a highly synchronized timeline.
According to the source, the actual protocol is highly structured. Patients typically receive acupuncture twice a week during the preparatory phase leading up to the IVF cycle.
Right, this is the groundwork, optimizing the blood flow, downregulating the systemic inflammation, and clearing the static on the HPO axis before the heavy medications even begin.
Then that foundational work is supplemented with highly targeted treatments, timed specifically around the clinical interventions, such as immediate pre- and post-embryo transfer sessions to maximize uterine receptivity.
Exactly. And often this is further supported by personalized herbal medicine protocols designed to sustain the metabolic shifts achieved through the acupuncture.
Beyond the cellular biology and the clinical protocols, the source highlights a deeply human element to this integration that deserves attention. The psychological and emotional toll of infertility, particularly when compounded by the unpredictable nature of PCOS, is immense. It can feel incredibly isolating.
Oh, completely. The clinical trauma of the IVF process is often overlooked in favor of the physical mechanics.
But patients who utilize these integrated therapies consistently report feeling more grounded, emotionally balanced, and significantly less stressed. To have an intervention that not only mathematically improves your chance of a live birth by 15%, but also anchors you psychologically during one of the most demanding experiences of your life, that dual benefit is immeasurable.
It really is.
So what does this all mean? When we synthesize the sweep of the data from this May 2026 meta-analysis, the conclusion is definitive. We have moved far beyond theoretical holistic concepts.
Yes, we have.
We now possess rigorous, top-tier empirical evidence demonstrating that acupuncture is a highly valuable, scientifically validated supportive therapy for the PCOS fertility journey. It optimizes the efficacy of pharmacological stimulation, yields superior embryonic development, and results in a statistically profound increase in live births.
If we connect this to the bigger picture, we are witnessing a fundamental evolution in reproductive healthcare. We are shifting away from the antiquated view that the reproductive system is just a mechanical apparatus that can be forced into submission with enough exogenous hormones.
Exactly.
We are finally acknowledging that the entire biological ecosystem dictates the outcome. Integrating the systemic neuromodulatory reach of acupuncture with the hyper-focused brilliance of IVF creates a synergy that neither discipline could achieve in isolation.
It represents a mature, sophisticated era of medicine where we leverage every available mechanism, ancient and modern, to optimize human health.
Absolutely.
It truly is the ultimate marriage of the micro and the macro. And it leaves me with one final thought, something for you to mull over as you go about your day. We just spent this entire deep dive exploring how acupuncture transforms IVF by targeting underlying systemic issues, like stabilizing the mitochondrial power grid, flushing out chronic oxidative stress, and repairing the communication on the HPO axis.
Right, releasing that biological parking brake.
Exactly. But if managing a patient's holistic inflammation and nervous system response is empirically proven to be this effective at altering highly clinical outcomes, it forces a rather provocative question about the future of medicine.
Oh, I see where you're going.
Should interventions that manage systemic inflammation and neuroendocrine stress be considered a mandatory non-negotiable baseline for all fertility treatments, rather than just an optional complementary add-on you have to seek out yourself?
Wow. That is a fundamental question the traditional medical establishment will have to confront as this integrative data continues to mount.
Something to think about. Until next time, keep exploring.